It's 8:43. Good morning, AM 1430 KRGI and 105.5 FM. I'm Brian Gallagher. We have a guest in studio today from Central District Health Department. Colette Evans is here to talk about an important awareness day coming up tomorrow. First, welcome back. Good to have you here.
Thank you. It's good to be here.
Tomorrow is International Overdose Awareness Day, and we've heard so much about opioid problems and things, and overdoses can happen just like that. Mm-hmm. And that's one of the things we want to talk about and make sure that you have a total understanding of and a way to help prevent them very easily. So I'll let you kind of go from there.
Thank you. We know that the impact of substance abuse overdoses has impacted our community greatly, and we've seen our share of deaths just in our own community from people who have overdosed. Typically what happens is they get what they believe to be an opioid, and it's laced with fentanyl, and unfortunately it's claimed way too many lives, not just in our community, but it's a crisis in our entire nation. And with tomorrow being International Overdose Awareness Day, we really want to bring awareness to the problem. We want to reduce the stigma that's associated with people who use substances, who try to get treatment, or who try to build their toolbox to help fight and ward off overdoses. So we really want to bring awareness to it so that we can try to reduce the number of overdose deaths and overdoses that we see in our community. So one of the things that we really encourage is that people just know what the signs are and the symptoms when they're potentially with somebody who is overdosing. They have pinpoint pupils, they have very shallowed, slow breathing, they make gurgling noises or kind of some choking noises. They may appear to fall asleep when they're actually losing consciousness. They get very weak. Their body goes limp. If you touch their body, it's cold and clammy. Their skin gets discolored, especially in the lips and the nails. You see that to start turn blue or purple. And so there's a couple of tools that are really important that I want to talk about that will help anybody who's in a situation where they might know somebody who's overdosed. Maybe they have a family or loved one. So just some things to keep on hand just in case. One of those being Narcan, which is a nasal spray that can reverse these symptoms of an overdose. It's a nasal spray. It's very easy to use. It's very easy to obtain. We have 4 pharmacies in the Central District who carry Narcan that you can get for free. You don't have to pay. You just go into the pharmacy, you tell them what you want, fill out the paperwork, they give it. You're in and out within 5 minutes. Very easy. It's a lifesaver. So I would encourage anybody to keep it on hand because you don't know if you have somebody in your family that's using, or a friend, or maybe you're at the mall and somebody passes out and it's from an overdose. You can use this nasal spray. The nice thing is that if somebody is in a emergency state and you administer Narcan and they're not in overdose, it's not going to be harmful to the person receiving it. It's safe for pregnant women. So there's no repercussions really if you give it to somebody who's having a condition other than that. And then, of course, you want to call 911 immediately. The other thing that we have are what are called Deterra pouches, and we have a supply of them that we received from the Department of Veteran Affairs, as well as some from Central Nebraska Council on Alcoholism and Addiction. Both of those agencies are here locally. And what this pouch does is it's when you feel the outside of it, it feels like it's filled with little beads, but there's ingredients in there that deactivates drugs. So if you have unused medication that you don't want anymore, or maybe you've been given a prescription of opioid for an injury and you no longer need it and you want to dispose of it, this is a really, really safe way to be able to do that. That way you're not dumping it down the garbage and risking somebody else getting it. You're not dumping it down the toilet where, the potential of it getting into the water stream. It's a very safe, effective way. You tear open the top of the pouch, put your medication in it, fill it with water, seal it back up, and within about 30 minutes it works on deactivating that medication. One of the things that we really want to push is that, we know that there's people who are using opioids for pain relief. and they don't need it anymore. And there's always people out there who are searching for that to feed an addiction. So by using this, it's a safe way to get rid of it without having to worry about it getting into the wrong hands.
Tomorrow is International Overdose Awareness Day. Colette Evans from Central District Health Department has been sharing some vital information on things that you can do to help prevent overdoses from happening, whether it's intentional or accidental. But if someone is suffering from an overdose, there are some things available to help them get through the situation. You still need to reach out to some kind of a medical provider. Even a call to 911 can help get emergency reaction. But these are things that are designed to help stop that major emergency issue and perhaps extend a life. So these are things to keep in mind. Don't just sit there and say, well, I don't know what to do. They have information. Now, folks would like to find out more about this. How can they learn more?
They can call our office at 308-385-5175, or they can stop in. We have Deterra pouches at our front desk, so if anybody wants one, they can come in, ask for one, and receive it at no charge.
This is really important stuff. Colette Evans, thanks. Good morning from AM 1430 KRGI, 105.5 FM.